Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. We are discussing a very rare case of post C-section complication. This is sagittal T2 weighted sequence, and here we have axial T2 weighted sequence. This is basically a 30 years old female patient who presented with foul smelling pussy discharge from lower interior abdominal wall. On MRI we can see there is abnormal tract which communicates with uterine cavity through interior uterine wall, and it extends into interior abdominal wall, from where it disrupts through linea alba between rectus sheath on either side. Here we can see it extends through rectus sheath at the level of linea alba into interior abdominal wall on left side. We can trace it. This is muscular portion of the anterior abdominal wall. From here it extends into abdominal cavity. Here we can see it communicates with interior uterine wall. This is 7.9 centimeter obliquely oriented fistulous tract, and it is called as Uterocutaneous Fistula. It is a very rare case, as in last 200 years we have seen only 120 cases. Usually we see fistulous communication between urinary bladder and uterine cavity, and we can also see fistulous communication between uterine cavity and adjacent gut tubes. But here we see this is a fistulous tract between uterus and interior abdominal wall. We can diagnose this by giving contrast through interior abdominal wall, that is performing fistulogram. We can also use CT scan for its assessment, where we can give contrast through the opening in interior abdominal wall and see its communication with the uterine cavity. Similarly, hysterosalpingography can be performed to see its communication, but we see that MR is the best modality for the assessment of this post C-section complication. Here we see urinary bladder is smooth walled and normal, and there is a thin strip of fluid in the left adnexa which communicates with fistulous tract in interior abdominal wall, and we can see the right ovary is normal with few follicles are noted in it. This is a dominant follicle in the right ovary, while in left ovary we can see dominant follicle. Pelvic bony boundaries are unremarkable. Pelvic muscles are normal as well. There is no pelvic lymphadenopathy in spite of previously mentioned complication. Lower lumbar vertebrae and sacrum is unremarkable as well. So this is a case of post C-section complication named as Uterocutaneous Fistula. Thank you very much. Assalamu alaikum warahmatullahi wabarakatuh.